covering the Northern Bahamas? You're watching the Bahamas Tonight, Northern Edition.
Welcome back. Our Grand Exploration segment is back. It is our segment every Wednesday telling you of exciting things to do on Grand Bahama. Tonight we will explore a local water park and show how zipping can be a whole lot of fun. Their doors have been opened for just over 2 years, and they're already zipping their way as a top spot to chill out on Grand Bahama. Co-owner of Pirates Cove Zipline and Water Park, David Wallace, is touting the water park as one of the best family-friendly locations to visit.
We were able to open the zipline, which is a 30-foot or a 50-foot 6-tower or 7-tower zipline. First of its kind, not only in Grand Bahama, but in the Bahamas as well, the zipline is. So persons coming into the park, they pay an admission of $5.75. That gives them use to the kayaks, access to the kayaks, the paddleboard, the water park, the freshwater shower, the beach volleyball, the tug of war, the mermaid pool, and the swings. And so we offer them 7 different things, along with the Wi-Fi, 8 things for their entrance fee.
Now, if you want to kick your adventure up a notch, Wallace says additional activities are also available.
If they want to do the jet skis, the banana boat, or the parasailing ride, they're able to do so. The hardest thing is the beach massage, of which we're going to have you experience today, where a lady does $25 for 20 minutes beach massage in the park. We have an ice cream booth, a souvenir booth, and a wood carver now open in the park. We have 2 souvenir booths, and then we have the hair braiders. And so persons who come in, they can either rent lounge chairs and umbrella, they can sit around the bar, or they can sit around the deck, and they can have a wonderful time here at Pirates Cove Zipline.
The water park also features wood carving, fresh conch salad making, and much, much more.
The Blackbeard Street Bar is the bar that is open. People enjoy this outdoor atmosphere, but more importantly, I tell them the tree grows at the bar and the bar gets you drunk. We have Pirates, we have the 3 restaurant Jack Sparrow. They do the shrimps and the lobsters. We have Island Boy Rolly. They started out doing grills, which they still do, but they now also do crack conch and fries. And then we have Pirates Tavern down in the trailers. They do more pizzas and specialty wings.
These tourists say they fully enjoyed the water activities.
We just had a blast today. We were out in the water. We went canoeing and hanging out, and we're talking about doing jet skis and zip lining and all the fun stuff. Checking out the iguana too.
Went canoeing and going to the beach.
Now, if you're interested in some fun in the sun, the water park is open 7 days a week, bright and early from 9 a.m. For locals, Wallace says they are currently running a special.
They zip free on their birthday if they bring along 6 other persons who pays for their zip line. And for the month of January and February, for locals we're offering 2 for the price of 1. So where a guest pays $60, the locals pay $30, and they get 2 to go for the price of 1, which you cannot beat.
Tonight, we continue our series on the ward, a look into mental health. In this report, we will hear of the critical role the mental health team plays in caring for patients with mental illnesses. Anxiety, depression, substance abuse, or bipolar disorder. Mental illnesses can present in many forms. But before a patient is admitted to the DIA ward, there are a few steps that must first be taken. Social worker, part of the mental health team at the Rand Memorial Hospital, Clarence Heel, says that it is important to get a full understanding of the potential patient.
The detailed information about an individual from the time their mother was pregnant with them until they would have come to us. It's a lifelong detailed information. And what that does is it encompasses medical, their educational background, employment background, family relationships, their drug history, legal history, various aspects about the individual.
Clinical psychologist Michelle Lundy says that Grand Bahama Health Services is mandated to have a holistic team which targets healing the whole person, both physically and mentally. As the team psychologist, Lundy says she focuses on a number of illnesses and signs, including psychological distress.
Psychological distress can be as simple as inability to cope. on the job with any of the pressures, any of the stresses that they may face, that the person may face, that is making them difficult to concentrate, that is making them difficult to function, that is making it difficult for them to even feel like coming to work, okay, so, or performing any of their daily activities. A lot of times that person only needs talk therapy, right? And so some of the therapies that I deal with, one of the big ones is cognitive behavioral therapy. Putting it in a nutshell, what it's saying is that the way a person thinks affects the way they feel, and as a result, the way they behave.
Now, once a person has been treated in the hospital and discharged, they could qualify for in-home visits. Psychiatric nurse, a part of the community psychology, Itap Uda, says that studies have proven that patients tend to cope better in their home environment.
The kind of referrals we used to send patients to Sunderland's, that has been greatly reduced, and the inpatient care in die ward is also greatly reduced. So the readmission rate is reduced. The rate of relapse, even at home, is reduced, and the quality of life, the quality of care they are having at this time is greatly enhanced.
Here in Grand Bahama, there is a noticeable population of persons who roam the street. Uda says that persons must have been seen and diagnosed by the team before qualifying for the registry of visits.
We cannot just go to everybody on the street. So we have to really have a register, and then we work towards that, because every human being has a right like any other person. So not because the person choose to behave the way he's behaving and then you want to label him or her as being psychiatric.
And now it is time to ask the doctor.
This is Ask the Doctor. Hi and welcome. Rosa asked, are women more at risk for heart disease than men? Your question is so timely, Rosa, and thanks for asking it. February is recognized as Heart Health Month. The American Heart Association's signature women's initiative, Go Red for Women, is a comprehensive platform designed to increase women's heart health awareness and serve as a catalyst for change to improve the lives of women globally. Heart disease remains the #1 killer in the Bahamas for both men and women. But one reason we try to raise awareness of heart disease, particularly in women, is because their symptoms may be different and they may not experience the so-called typical symptoms such as chest pain, left arm pain, or shortness of breath. Results from a previous U.S. study by the National Institutes of Health suggests that women often have new or different physical symptoms for as long as a month or even longer before experiencing a heart attack. Surprisingly, 40% of women in this study report that they had no chest pain during any phase of their heart attack. If you or someone you know is experiencing symptoms suggestive of a heart attack, please call 919 or go to the emergency room immediately. I'm Dr. Monique Pratt, and this has been Ask the Doctor.
Don't go away, sports is up next with Rumiko Knowles.